Assalamu alaikum. This presentation is on the basic analysis of a voice signal, the methodology for the analysis, and the range of normal values and values when things go wrong. The basic analysis of a voice signal would cover the fundamental frequency contours, the speaking fundamental frequency distribution and histograms, the mean speech fundamental frequency and its dynamic frequency range, coherence percentage, and then the perturbation measures, including frequency perturbation, the voice jitter, and amplitude perturbations, the voice shimmer, and finally the harmonics to noise ratio. Fundamental frequency contours is a graphic representation of changes in the voice fundamental frequency over the time of a certain voice production period. It registers the changes in the fundamental frequency during this time period and also shows the maximum frequencies used, the lowest frequencies used, the range of the frequencies between maximum and minimum, and the time spent uttering any particular frequency, the higher or the lower or the middle frequencies. The next question would be, for how long does this individual uses certain frequencies? Which frequencies is he using most? Which frequencies he is using less? How long he would use high frequencies, and for how long he would use very low frequencies. For this, we convert the speech fundamental frequency contour into a speech fundamental frequency histogram, where the x-axis are frequencies and the y-axis at the time spent during voicing these frequencies. The x-axis is divided into columns called frequency bins. These columns have a very narrow frequency range, and every time the speaker uses this very narrow range, it would be included into the corresponding column. The columns are equally spaced according to the octave, the semitones, and the quarter tone scale, because this is how we perceive changes in the vocal pitch. So we would know from this that this individual speaker had used these two frequency bins, this narrow frequency range, most of the time, and he uses less the very high frequencies and the very low frequencies. We can also estimate which frequencies he is using for 90% of the time by excluding 5% here and 5% there, or 80% of the time by excluding 10% here and 10% there. So we know something about the frequencies he is using most of the time. And that's how the mean speech fundamental frequency is estimated. From the histogram, we would know where exactly is the central tendency for the frequencies used by an individual, and we'll also get an idea about the range and the standard deviation. We would know that if the mean speech fundamental frequency is shifted to the lower frequencies, that there may be an increase in the vocal fold mucosa mass, with conditions such as polypoidal degeneration of the vocal folds, rhinx edema, or hypothyroidism. Or if the mean values here shift towards the higher frequencies, we would know that there is increased scarring or stiffness of the vocal folds, puberphonia, and also laryngeal cancers, and some cases of recurrent laryngeal nerve palsy. And from such a histogram of the speech fundamental frequencies, the DX1, we can identify problems with the speech fundamental frequency range, the range of frequencies used during speech. If the speech fundamental frequency range is restricted with a narrow base like in here, we think about organic problems in the vocal folds, or neurological problems like Parkinson's disease, in which the individual would use only a narrowed range of speech fundamental frequencies, or psychological problems like depression and to some extent schizophrenia.
Also, some individuals with some problems in controlling of the vocal folds vibratory pattern, with irregularities in the pattern, they will empirically find that narrowing up of the speech fundamental frequency range would cover up for such irregularities. On the other hand, a wider than usual range could be normal in individuals who have exaggerated use of their dynamic range, or it may reflect dysphonia. Another parameter of interest is the variability in the speech fundamental frequency. We can calculate from the histograms the average distance between each frequency and the mean speech fundamental frequency. That is to say, we can calculate the standard deviation of the speech fundamental frequencies, the average distance between each individual reading and the mean speech fundamental frequency. This is the speech frequencies standard deviation, the pitch sigma. And this reflects a degree of the variability in the speech fundamental frequency. But a better way of identifying variabilities in the speech fundamental frequencies is this: the difference between DFX1 and DFX2. DFX1 is the histograms we have been through so far, which identifies how often a certain individual would be using certain narrow frequencies. So if he is using these frequencies most of the time, the average or the mean speech fundamental frequency would be here, and he uses higher and lower frequencies less. This is marked here as the red histogram. On top of the red histogram, you can overlay another histogram, the DFX2, which contains in these bins the pair of successive frequencies that have been used during the utterance of this frequency. So all the frequencies in this column would be analyzed if the successive or the following frequency for all these frequencies are no higher or no less than 10% from the first frequency, then it can be counted in the second histogram, the DFX2. So the closer the second histogram to the first, the better, because that would indicate that successive frequencies are quite close to each other, which gives a smooth voice, a smooth vibratory frequency change, and a good voice. So this would give an idea about how close are the successive frequencies to the original frequencies obtained from the DFX1. And the closer the two together, the better for the voice. Another way of demonstrating and measuring the irregularities in the voice signals would be the use of the scatter plot, the CFX, in which on the x-axis it would represent the fundamental frequency of each cycle, and on the y-axis the fundamental frequencies of the cycle immediately after the original cycle will be plotted. So if you have a cycle of, say, 100 Hertz frequency on the x-axis, and the immediately following cycle has a frequency of 150 Hertz, it would be, the dot would be plotted in here. If it is exactly the same 100 Hertz like the preceding cycle, then it would be on the diagonal line in here. The more dots we have on the diagonal line, the better the voice, because that would mean that the cycles are followed by very similar cycle frequencies as well. The more dots we have off that diagonal line by more or less than 3%, this would tell that the preceding cycles are far from the original cycles, and this would give a certain degree of dysphonia.
The irregularity in the cycle-by-cycle vibrations of the vocal fold can be quantified by the irregularity score percentage. In the scatter plot, the number of dots away from the midline would indicate the irregularities in the cycle-by-cycle changes. In a patient with recurrent laryngeal nerve palsy, like in here, you see a lot of dots off the diagonal line. Things got better after a thyroplasty operation, and now most of the dots are aligned along the diagonal line in here. So the number of dots that are away from the diagonal line by more than or less than 3% would be counted against the total number of the dots to give the irregularity score percentage. This percentage in normal individuals reading a passage, if it's a male, it's about 12%, and if it's a female, it's just more than 7%. For males and females in a normal conversation, the score would be higher at 23.5 for males and 12.3 for females. In this example of recurrent laryngeal nerve palsy before and after thyroplasty, the figures were 18.9 before the thyroplasty and dropped to 6.99 after the thyroplasty, reflecting improvement in the voice.
Now this is to sum up how the graphs for a normal male voice and a normal female voice would look like. If it is the histogram of the speech fundamental frequency, you would see a central tendency here somewhere just more than 100 Hertz, and you would see the scatter plot are more or less, most of the points are around the diagonal, indicating that minimum cycle to cycle changes in the fundamental frequency. And the same for the females, you would have higher frequency here. The speech fundamental frequency central tendency would be above 200 or so, and again the scatter plot would show that the diagonal line would have most of the points indicating a regular cycle by cycle variation in the fundamental frequency.
And these are some of the normal data for adult males and females with normal voices, including smokers. It shows the mean speech fundamental frequencies in Hertz. For men is about 109, doesn't change much between reading and conversation. Much higher in females at 190, little bit less during conversation. The 90% dynamic frequency range would give the range of frequency, the middle 90% range of the frequencies after removing the bottom and the top 5% of this range. It's about 1 octave for both men and women, a bit less than 1 octave while reading, and a bit higher than an octave in normal conversation, and something similar applies to the females. The irregularity score, men has a much higher irregularity score, CFX percentage, compared to females with about 12% in reading and almost double that in conversation, while in females it's 7.6 and 12.8 in conversation. The contact quotient percentage reflects the relative amount of time during which the vocal folds are in good contact during their glottal cycle, and it should be somewhere around 45% in cases like vocal fold palsy with no much good contact between the vocal folds edges during phonation. This may drop to 20% or something. Also, the standard deviation of this contact quotient, reflects the irregularity in the control of the vocal folds movement during the glottal cycle. For decades, it has been observed that the commonest
finding in the pathological voice conditions is a strong tendency for frequent and rapid changes in the vibratory cycle frequency and amplitude. The changes in the vibratory cycles, the consecutive or adjacent cycles amplitude, are called the shimmer, and these can be observed directly using a video stroboscopy as in here, or high-speed video films. They can also be measured. The acoustic consequences of these irregularities can be recorded and analyzed. Perturbations can occur normally during speech. The voice sound in speech are not always entirely periodic. Even the most serious attempt by a speaker or a singer to produce steady phonation, like sustained vowel for example, would end up with some tiny changes in the frequency and the amplitude of the glottal cycles, producing a certain amount of jitter and shimmer. It's only when this exceeds a certain threshold that they become noticeable and pathological. Why do we have these perturbations in the voice even with a normal voice production? The causes are multiple. They can be of neurological origin, biomechanical, aerodynamics, and some acoustic sources as well. There can be some fluctuations in the action potential of the laryngeal muscles during phonation, or some fluctuations in the distribution of the mucus on the vocal folds, or some asymmetry in the vocal folds structure during phonation. There can also be fluctuation in the airflow emerging from the glottis with each glottal cycle, and there can be irregularities in the interaction between the source, the glottal signal, and the vocal tract. In normal persons producing a vowel continuously, the fundamental frequency of successive glottal cycles would be expected to be quite close. The time taken for each cycle from the start of the cycle to the end would be very similar to the time taken by the successive cycles, with only a very minor variations, usually less than 1%. The voice jitter is defined as the variation in the voice fundamental frequency from cycle to cycle, while producing a vowel continuously, and usually reflects a lack of control of the vibrations of the vocal folds. It's expected to be higher in patients who have voice pathologies than the average jitter in normal individuals while producing a vowel, where the variation should be between 0.5 and 1%. In normal individuals, for example, a male producing a modal voice uttering the vowel ah continuously, you could see on the top chart here the very fine irregularities in the fundamental frequency from cycle to cycle. These variations in the fundamental frequencies are much coarser if the patient has a hoarse voice, as you can see in the bottom chart. What are the expected values for jitter in patients who have dysphonia and in normal individuals with normal voice? This report from Entry Hospital in Manchester shows the values for jitter in normal individuals, where the value is generally less than 1%. Only one single individual had a jitter value of about 2% while having a normal voice. On the other hand, patients who have a hoarse voice had a much higher values for jitter. Only one single patient with a hoarse voice had a jitter value about 2%. So generally speaking, the jitter values would be expected to be much higher in patients who have hoarse voice compared to patients who have normal voice, in whom the jitter typically varies between 0.1% and 1% of the fundamental frequency period. What is the correlation between jitter as an objective measure of voice and the subjective grade of hoarseness? You could see from here that with low grades of hoarseness of voice, you would expect low grades of jitter percentage as well. But with higher grades of dysphonia, like in 8 or 9, you could see wide variations in the percentage of jitter for the same grade of hoarseness. Like, for example, grade 8, it varies between maybe 4% jitter and about 17% jitter for the same grade of voice. The relationship between jitter and the subjective hoarseness grade is not linear. You could see all these dots scattering away from the diagonal straight line. Perhaps about 50% of the hoarseness can be explained in terms of jitter. This is the effect size in here. So jitter is not universally correlated with hoarseness, and the validity of the jitter percentage test and even its reliability has been questioned by some authorities, particularly in severely dysphonic voices. The amplitude of consecutive glottal cycles are not always entirely symmetrical. Sometimes there would be small changes in the amplitude between these consecutive cycles, and if these changes in the amplitude exceed a certain threshold, they become an indication of voice pathology. The amplitude perturbations are called vocal shimmer and are defined as cycle-to-cycle fluctuations in the amplitude of the adjacent cycles. As with jitter, which is the perturbations in the fundamental time of each glottal cycle, there have been many ways in which the vocal shimmer can be quantified. The simplest is, of course, the average shimmer across a certain period, when the differences between consecutive cycles are added up and divided by the number of the cycles. The intensity of the voice, the amplitude of the glottal signal, is related to the subglottic air pressure and to the resistance to the airflow at the glottal level, the glottal valve resistance. This resistance is in turn dependent on things like the vocal fold's stiffness, the vocal fold edge's vibrating mass, and the vocal fold's contact mode. The shimmer can change with reduction in the glottal resistance and also with mass lesions on the vocal folds, and can also be seen that it correlates with the presence of noise emitting with the glottal signal, particularly with things like breathiness related to a reduced glottal valve resistance. A small amount of shimmer can be observed in normal voices even while producing things like sustained long vowels, which is meant to produce the least amount of irregularities in the glottal cycles. These irregularities, the random fluctuations between the amplitudes of the glottal cycles, would increase markedly while producing normal speech or while reading, and also with the aging voice. When compared with the amount of fluctuations in patients who have dysphonia or have voice pathologies, the patients who have voice pathologies have more shimmer compared to normal individuals, and the difference between a dysphonia and a normal person increases with measuring shimmer with sustained vowels more than with reading or speaking normally. Beyond a certain limit, a certain threshold, the amount of shimmer may indicate a voice pathology. The shimmer can be measured and quantified in several ways. The easiest is shimmer absolute or local shimmer, in which the difference between consecutive cycles in a certain time frame are all added up and then averaged by dividing it by the number of the cycles minus 1, and this will provide the shimmer absolute in decibels
and the threshold for detecting dysphonia is any average above the threshold of 0.35 decibels, a very tiny amount. The Shimmer relative, which is used more, or the Shimmer percentage, is the same Shimmer absolute in relation to the average amplitude of the cycles in the same time frame. So if the Shimmer absolute is divided by the average amplitude of the cycle in that time frame multiplied by 100, this will give the Shimmer percentage, and the threshold for detecting dysphonia is anything above 3.81%. There are other ways of measuring Shimmer, including things like the 3-point or the 5-point or the 11-point amplitude perturbations, in which several cycles are used rather than just individual cycles variations to obtain the Shimmer quantification.
The other issue is how these perturbation measures, jitter or shimmer, are correlated with the way we perceive voice in terms of dimensions like roughness or hoarseness or overall severity of the dysphonia. Again, there is no consistent evidence for a direct relationship between a perturbation measure and a perceptual dimension. Listeners could tell that there is a certain degree of noise or irregularity in a voice signal, but they find difficulty in isolating jitter and shimmer as separate dimensions from the spectral noise in the voice, at least with the current ways of quantifying perturbations, of quantifying jitter or shimmer. Perhaps because of the variety of the technical problems in measuring these perturbations. This has prompted some investigators to question the utility of perturbations measures in general in characterizing the voice quality. The energy in the normal voice signal is primarily composed of regular harmonics. But there is also another component of inharmonic energy in it, even in normal voices. So long as the harmonic part of the voice energy vastly exceeds the noise part, up to 7 times the noise part, the voice can be perceived as normal. This ratio may drop a little bit in the elderly, so the harmonics will be about 5 times the noise, and in the children where it is between 2 or 3 times the amount of noise in the signal. The HNR, the harmonics to noise ratio, is the ratio of the energy in the harmonic component of the voice in a special frequency range compared to the inharmonic component in the voice signal. If the ratio between harmonics and noise drops significantly, the voice can be perceived either as rough or it can be perceived as breathy. If a fundamental frequency of a certain voice is, say, 100 Hz, then all waves with frequencies that are positive integer multiples of this fundamental frequency, like 200 Hz, 300, 400, or 500, would be termed harmonics. Collectively, they will be termed higher harmonics. All other frequencies that are not an integer multiples of the fundamental frequency of the 100 Hz will be collectively considered as noise. The harmonics are all periodic at the fundamental frequency. The harmonics are formed due to the regular vibrations of the vocal folds during phonation. But what are the sources of the noise in the voice signal? The main sources are either air escape through the larynx or irregular vibrations of the vocal folds. Incomplete adduction of the vocal folds during phonation would lead to air escape, a breathy voice, and significant noise in the voice signal. This may also happen with increase in the infraglottic airflow or irregular mucosal waveforms vibrations during adduction, or abnormalities in the larynx in the form of focal lesions or muscle imbalance. If a raised subglottic air pressure is causing a pressed or a strained voice, there will also be significant noise in the voice, and voice signal with a lower pitch are often associated with an increase in noise. This concept of comparing the amount of energy in a certain signal to the amount of noise in that signal is used widely in various other fields in science and engineering to compare the desired signal to the background noise, and is often expressed in decibels. If the amount of energy in the harmonics are the part of the signal that are periodic, this can be estimated and would form the numerator of the equation. The amount of energy in the noise part is irregular and random fluctuations in the energy level that over a certain period of time would actually average to about zero. So the amount of noise, the energy in the noise, would be the standard deviation of these irregular and random fluctuations, because the average of them is actually zero. And this is the equation used to drive the signal to noise ratio, and H and R is a special form of this equation.
The ratio between the two voice components, the harmonics and the noise, reflects the efficiency of the voice production. The greater the flow of the expelled air from the lungs into energy of vibration by the vocal folds, the greater the H and R will be, and the better the voice would be. A low H and R below the threshold of 7 dBs probably indicates dysphonia and a pathological voice production. By this, we come to the end of this presentation on the basic analysis of a voice signal. Assalamu alaikum.